Banner Health has a pretty active capital program. We average between 120 to 130 active projects at any given time. Total value about $1.5 billion that seems to be active, ongoing. And those projects can range from a small $250,000 project to a large $389 million project. We've been using eBuilder a little over 4 years now, and basically use it to manage all of our projects across our project teams, heavily using it for our project accounting, documentation, issue management, and schedule management. I think primarily, probably the biggest benefits we've had is being able to very accurately manage our project accounting. I have a great deal of confidence in where we are in our projects right now, where before we didn't. They were spread across dozens of spreadsheets, individual spreadsheets with no way to roll them up. And now with the press of a button, I or others can see across the entire program at any given moment, as well as each individual project can see with a great deal of accuracy where they are and where they're going as they forecast the completed cost of the projects. I think probably the biggest quantifiable benefit that we've been able to identify is something we did recently where we moved a little over $70 million out of active projects. These were ongoing projects that are anywhere from halfway complete to say 3/4 complete. Because of our level of accuracy in project accounting and the forecasted costs of project, we had the confidence to go into a number of large projects as well as many small ones that were near complete and mine unused funds that we could now say, given where we are in the project, we won't use them, and take those funds and move them so we could utilize them on other projects. In this case, that $70 million went to fund a new cancer center that's now under construction that'll open next year. Well, the biggest impact to the Banner Group if we stopped using eBuilder is they'd be -1 vice president. I'd leave and go someplace else. Quite frankly, I couldn't function in my job without a system like eBuilder. But it would certainly undermine our way of doing business. It's so ingrained in how we function now and manage across all of our teams and projects which are dispersed across 7 states. In Banner, we simply couldn't function anymore. I don't think we had major adoption challenges. We probably had 2 categories as I think back. One kind of minor, and they were little things, and how we labeled things like commitments and payments. And what we found is we didn't define those well enough in the beginning. And we were starting to get variation across our teams as we were implemented. So I wish we had spent a little bit more time up front defining some of the minutia of how we would label things in eBuilder so that we had the consistency from day one. The other type of adoption challenge we had was nothing to do with rejection. It actually had to do with over-enthusiasm. We have a lot of smart project managers and staff who got enthused about the system and wanted to go faster than we were able to go as an organization, wanted to do things that we weren't quite ready to do. And in some cases we had to hold them back and say, we'll get there, but let's move as a group so we do it consistently. My experience with eBuilder as a company has just been exceptional. One of the best experiences I've had. I've dealt with many companies, many organizations, and I just find them very easy to work with, very customer focused. We get terrific response when we call with a question or a need. One of the things I like the most about eBuilder is it's constantly improving and getting better. It started out as a great product the first year, and it got better the second year, and got better the third year, and got better the 4th year, and I think it'll be better the 5th, 6th, 7th, and 8th years with ongoing improvements. So I'm very pleased with the product. Well, we send reports out to all of our, we'll call them our admin teams. So at each medical center where we're doing a major project, the team that's involved with the project, maybe the CEO at the medical center, the CFO, some other key leaders, the directors that are directly involved with the project. We send them monthly reports right now that are assembled with reports from eBuilder as well as other documentation that we pull together. We package it within eBuilder and we send it out through eBuilder so we can move it to them to a position where they can read it. So quite a few people get reports from eBuilder.